Good morning. My name is Cathy Maccoux, and this is my husband, Dan. We feel so honored to be here to speak and share our experience with hydrocephalus and the journey we have been on, specifically the financial sides, and some things we have learned through the years that we would like to share. I'll start out by telling you a little bit about our family and how we went from a typical upper middle class family of 4 to not only fighting for our girls' lives, but also trying to keep track and pay the medical bills as they started to mount and never stopped. Our oldest daughter, Amanda, was born in 1985. She was beautiful, and we enjoyed every moment as she grew. Then in 1990, we welcomed our second daughter into this world. Once again, we were thrilled, and we're literally living the American dream. We built a beautiful home. Amanda was an amazing dancer and loved school. Tracy found her niche in swimming. In fact, she was the top swimmer in the state, and she was ranked 25 in the nation. So between the two girls, we were running around and enjoying every bit of it. At that time, I was doing either childcare as a nanny, or later I did daycare in my home. Dan has had great jobs in the ever-changing semiconductor industry, and everything seemed wonderful. We were living life to the fullest and had nothing but good health and fun times ahead. So we thought. In 1995, our lives changed drastically. We were thrilled to find out that we were having another little girl, and were hoping for our good life to continue. Then at around 21 weeks into my pregnancy, I started going into labor. This was definitely not something we wanted to happen. We now had to change things up a bit. I was put on bed rest, so Dan had to take over most everything around the house. This also meant that I had to stop working. This was something we could not afford, but we assumed it was short-lived, we could get it back with no problem. On December 22nd, 1995, I was rushed to the hospital by ambulance, and our tiny little girl, Olivia, was born almost 3 months premature. Our life forever changed at that exact moment. Let's see. Olivia weighed in at about 3 pounds, and she spent the first few months in the NICU. Those few months were a bit of a blur and also a roller coaster of emotions. One day she would be doing great, and then hours later she'd be fighting for her life. Our total focus was on Olivia's health. We weren't thinking about the mounting medical bills, but we did have friends starting to worry for us. They started to ask if our insurance had a lifetime cap. Unfortunately, finances were the last thing on our mind. And we also figured, what could we do if they had a lifetime cap? There was nothing we could do about it. So that was the last thing on our mind. Olivia was able to come home in March, and we were hoping for a quiet life going forward. But that plan did not work. Olivia did end up suffering brain bleeds at birth, which eventually turned into hydrocephalus. As you all know, the only treatment for this is brain surgery, where they place the shunt system. We were told at the time of her first surgery at 9 months that the shunt they placed should last about 30 years. Little did we know. We left the hospital totally relieved that we could now start living our lives without the worry about her needing surgery. Unfortunately, things did not go so well for Olivia. Almost immediately, she started having issues. A shunt is a medical device, and they do fail. Her shunt was just not working for her, and she needed a new one by age 2. We went in once again thinking this would be a quick fix and we would get back to our normal life. That did not happen. In fact, Olivia ended up being in the hospital that stay for over 165 days. This included many brain surgeries, severe MRSA shunt infection, and a reaction to the antibiotics that almost took her life. This was a very scary time for all of us. Olivia was fighting for her life. We were trying to be with her as much as possible, plus keep up with the other girls doing their normal schedules, such as school, swimming, and dance. And on top of that, I once again had to quit my daycare job in order to be with Olivia as much as I could. This was the first time that the financial issue really started to hit us. And not only did we lose my paycheck, but Dan needed to take unpaid time off at times due to no vacation available. We still had all the same bills, but now we had to add on parking, food for home, thousands of dollars in hospital bills, which were now piling up. Once things calmed down and Olivia was slowly recovering, we all took a deep breath. But this once again did not last long. Before we knew it, we were right back in the hospital with Olivia. This had now become truly our second home. Olivia was having an average of 2 or 3 shunt brain surgeries every month. Everyone was frustrated. We started looking for second opinions. This was not cheap. But we had no choice. It was our daughter's life. We flew to Chicago and to Arizona for answers. These trips were very expensive, and we also had to pay for the neurosurgeons on our own since they were out of network. We did whatever we could to help Olivia. At this point, lines of credit were our best friends. We literally had no choice. Through all of this, we did the best we could to keep on going. We felt we were pretty good at that. Then our life was rocked one more time. Our middle daughter, Tracy, was diagnosed with complex regional pain syndrome. It's a chronic pain condition in which high levels of nerve impulses are sent to an affected site. It's a horrible pain disorder with no cure. How could this possibly be happening to us? I cannot explain how horrible this news was. This time, not only were we devastated for our daughter, but we were feeling the financial burden, and now we knew we would be completely buried and we would never get out of it. So life goes on. Now we had two very medically fragile girls. At first, our friends and families were there for us and doing everything they could. This included meals, rides for the kids, along with fundraisers. Unfortunately, with our situation never ending, people get what we call compassion burnout. They do not have the ability to keep it up. They also do not know what to say or things to do, and when things go from bad to worse. At this time, we had to become a well-oiled machine. I would take care of all the medical appointments and needs, and Dan's second full-time job was dealing with insurance companies and medical departments, trying to figure out the medical costs and how to pay. At times, the girls actually shared hospital rooms. How sweet, we had our own little place. Olivia is and always will be dealing with her health issues. In her 20 years, she has endured over 130 brain surgeries. She is a beautiful and talented young woman in spite of her struggles. She graduated on time and with honors and went off to college. Of course, close to home, but even more important, close to her neurosurgeon, this last year. Nothing is ever easy, but she always pushes through. An example of this was in October of 2014, while she was in her dorm alone, she suffered a seizure, which landed her in the PICU intubated, since she could not breathe on her own. But within weeks, she headed back to college, just another bump in the road. Unfortunately, these are the cards she's been given. Next. Through all of the medical issues we have been given to deal with, we did the best we could. Our girls all have been thriving and surviving in spite of the tough road they were given. Our oldest daughter, Amanda, is now a lawyer, working in compliance at a medical device company. Actually, she started at Medtronic, now she just moved to another place. She is happily married and gave us our first grandchild, Wyatt, who we spoil rotten. Tracy is now in her own apartment and is a lead swim coach at a large swim team in Eden Prairie, and she's still dealing with her condition but is trying to move forward. Olivia did have to take last semester off of college due to 2 shunt infections, 5 more brain surgeries, a new brain bleed, and many more complications. But now she is set to head back to college in August and continue on her journey in spite of the hydrocephalus, and she wanted me to add that she's scheduled to graduate in 2019. She added that last night. This is just a glimpse into our family trying to make it through the challenges we have been handed. Our medical bills will never go away. Now, Dan, who deals with the money, will fill you in on the financial burden of this situation and some tips that we have found that worked for us. Thank you.
Yeah, that's fine. All right. So throughout all of this, as you can imagine, the hospitalizations, the surgeries, and all the associated expenses that go with it, since 1995, really started to add up. And how do you absorb something like that? We began keeping spreadsheets tracking our expenses in 2005 when Amanda, our oldest daughter, started her second year of college. For reconsideration for financial aid available due to our financial burden. And we continue to produce those annually. So this is an example of what ours looks like. So again, we tracked for the entire family. So it was the date, who the person was. Back in this one, it was coded, but the miles to, the miles from, where we were going. And then there was individual areas for parking, breakfast, dinner, miscellaneous expenses, prescriptions, co-pays, and out-of-pocket. Yes, we still do this today. At the bottom of the spreadsheet, this is how it summarizes out. So it gives you a total for the parking, total for the meals, miscellaneous expenses, prescriptions, all that good stuff. So in this, I don't remember which year this was from. 2012 it looks like. And it gives a total out of pocket, and then on the left-hand side, that particular year we drove 9,060 miles for medical related. And from that, usually down below, there's a spot. Every year you can take a look at what the medical reimbursement is for mileage. So I also had the spreadsheet calculate for that. So as I mentioned, we started doing this in 2005, when our oldest daughter Amanda went to college. So all of the amounts that you see on the right-hand chart, 2005 through 2014, those are all actuals. So then what I tried to do was, okay, this has been going on since 1995. How do you create a historical perspective? So we took 2005 through 2014 and did an average of the out-of-pocket expenses and an average of the miles. And we reconstructed 1996 through 2004. So if you take a look at it, in the ones where we estimated, it was $131,000 out of pocket during that time based on averages. And I can tell you that in our position, this is actually considered conservative, because there was several years in here, we actually had one hospital stay that was 167 days. So again, the 96 through 2004 was constructed based on the averages.
You don't realize it until you do.
Oh yeah, once you start adding this up, it gets out of control pretty fast. So if we take those two and summarize them, the out-of-pocket was $277,000, and mileage, 118,000 miles. We literally wore out a car during that time. And there's other associated expenses that the IRS, or costs that don't really come into this, such as missed time from work and other miscellaneous expenses that the IRS does not allow, and most people do not think about. The daily costs really add up. You got parking, you got gas going back and forth, and in a lot of cases, food, just because it's not convenient to go back and forth. And in our particular case, what we ended up doing was I would literally stay overnight, Sunday through Thursday. I would get up and go to work. After the other kids went to school, Cathy would drive down, be with Olivia for the day. She would leave to catch them off the bus. When I was done with work, I would go back to the hospital. So you start taking all that into account, and it's just amazing how everything adds up. The tip for the medical expense spreadsheet. I understand everybody has different scenarios. Some people have had one shunt and have had it, knock on wood. And there's another set of population where it seems like there's just not a right combination and it's continually ongoing. So what we did is I started this for a couple of reasons. Number one, it was primarily driven from the college side of it. But the other thing it does for you is when you get your EOBs, you can enter the amount that you owe, because typically you'll get those first. The bills from the providers will actually start showing up probably 2 weeks to a month later. When you get it in the mail, you open up the spreadsheet, you take a look for that EOB, and now you got to cross-reference to make sure that the number that they have on there that you owe is correct, based on the number that was on the EOB. So it also creates kind of a cross-checking situation for you, just based on the volume of stuff that's coming in. Yeah, and based on the number of procedures, providers, all that kind of stuff, there was a period of time where better than 50% of the bills that were sent to us, we were able to prove were in error because we had all of the data. And without doing this, you literally have a stack of paper a foot tall, and you literally got to dig through it. So for us, it turned out to be a great tool. The tip that I have would be enter information as you go. It creates a more accurate picture because you're capturing associated costs real time, And I can tell you from personal experience, stockpiling of information is way too overwhelming, and many times you miss items. You know, use a large envelope to hold receipts and put copies of the EOBs in. And in my opinion, based on what we've been through, it's never too early to start, because you never know how things are going to go moving forward, and it provides an ability to portray a historical perspective. How what?
Why we do
Yeah. Kind of maneuvering through the system. Some of the providers that we utilized did offer some financing. It's a nice gesture, but typically they would only carry a balance for 6 months. So if you had a lengthy hospital stay, what you owed was $6,000. They would take the monthly payments were $6,000 divided by 6, it's $1,000 a month. With recurring hospitalizations, it's not an option. There was another company that we worked with, MedCredit Financial Services. It was similar to like a credit card type company, a little bit lower interest, but you would apply and they'd give you a line of credit, and that was another way to do it. When Olivia was first born, you know, you could call, you could make loose arrangements with somebody for payments, but as time has gone on, everybody wants their money now. So it really puts you in a tough spot on, you know, when you have something this massive, how do you deal with it? Everybody that we talked to said that there would be help available. After about a 5-minute discussion, typically what we heard, sorry, there's nothing we can do to help. Your income is over our guidelines. Balances kept growing due to ongoing repetitive nature of tracing Olivia's conditions, typically requiring hospitalizations and surgeries over the 19 years for both kids. In most situations, events are not this repetitive or as long of a duration. So admittedly, it's a little bit of an anomaly, but rare, or how do I want to say, extreme, but not rare. Financial impact to the family. Fundraisers, we had family and friends that organized a few fundraising events with little success. Typically what happens over this period of time, Cathy mentioned it earlier, you run into a lot of compassion burnout. People have their own lives. They get to a point they don't know what to say anymore. So those things are real, and it does happen. In 2005, we refinanced our home mortgage to obtain a better interest rate, as well as rolling over previous medical debt that had accumulated, and we had it spread out over various lines of credit. A downside to this, however, is that we had to go back to a 30-year loan, and we basically borrowed the maximum that we could based on our home's current value. In 2006, we took out a new home equity loan, and we increased our personal line of credit to finance the rest of the medical expenses. I wanted to include a few things that we ran into regarding insurance, private insurance versus public health plan differences. What we ran across is if you were employed and you had health insurance, there was virtually no assistance available, despite what you're being told. In most cases, the income guidelines were so low that, like I said, after a 5-minute discussion, there's just no help. If you were unemployed or you had no health insurance, the social workers were nearly tripping over each other to hand out free parking passes and meal vouchers. But because we had a job and we had a good income, nothing was available. Our insurance allowed quantity 10 generic Zofran per month for nausea. Friends of ours who were on the state program were allowed 60 name brand Zofran per month with no copay. Many of the prescriptions that we needed were on the Tier 3 formulary, and they were typically $50 to $75 per prescription after an appeal was granted by the review board. So in a lot of cases, because it's not in the drug formulary, it got prescribed. It has to go to a review board to get it, which could take anywhere from a day to 3 weeks. So in many cases, because it was stuff we had to have, we would have to buy the prescriptions, pay the full price, and then try to get reimbursed from the insurance company. This one, hopefully there's nobody from Cigna Great West in here. But throughout the years, we've had various plans, and I wanted to put this in just to make people aware. And like I said, opening line, hands down, the worst insurance provider we had ever had. Not all of the providers are within a participating provider. Not everybody was covered, and there was no way of knowing it until you received the EOB. As an example, Olivia would have an MRI that we knew was covered by insurance, but then we would find out much later that the radiologist who read the scan was not covered, therefore we owed that amount. Many prior authorizations were required. If it was a critical situation, there was no time to obtain prior authorizations, and many times this was a huge battle. Oh yeah. When we moved on to this plan, Olivia's neurosurgeon was not part of it. He was kind enough to apply and get accepted to it, but it was only him, none of the nurse practitioners, none of the physician's assistants. So we had to be really careful who came in and who did what. And one of the reasons I wanted to put this in here is this is becoming more and more prevalent today. You know, all of the health insurance cost is going up, but there's a lot more of these stipulations going into it. So my best advice is if you have an employer or you buy a plan on your own, make sure those are the things that you take a look at, because those can really make a huge difference. And this, trying to track all this stuff and understand it is a nightmare. Okay, so you've got the spreadsheet, you've collected all this information, what do you do with it? You basically draft what we call a special circumstance letter. In short, it's a summary document explaining your financial situation. You can use the financial hardship that you face to reduce the expected financial participation. This is primarily when your kids go off to college. They fill out a FAFSA. It always comes back with, here's the expected parent contribution. So what we were able to do with special circumstance letter was, after the FAFSA was processed, we'd turn all this information into the school, and they would reassess everything. And I'll cover it a little bit more. The age-old adage applies, can't get blood out of a turnip. So this is your opportunity to tell your story and plead your case. What do you do with it? Financial institutions for personal loans. We've had good success working with lending institutions that were small, kind of like a hometown feel, because typically the rules are a little bit looser and there's room for bending the rules. You go to any of the big banks, here's the guidelines. And we had zero luck working with any of the large banks. Small banks, small lending institutions, they're a little bit more understanding and they're a little bit more flexible. The other point I briefly touched on was graduating from high school and moving to college. If sufficient information is supplied, the financial aid department can take your financial situation into account and in most cases can alleviate a large share of the parent expected portion of the FAFSA amount. Again, this is based on guidelines. Once they apply, here's how much we expect the parent to contribute. After that, here's the loans you get. Yeah, and when we got adjustments made, many times they got some grants included. So that's money that does not need to be paid back. So very valuable. Briefly, this is an example of a special circumstance letter. This particular one is one we did for Augsburg from our daughter Olivia. Again, not a lot of rocket science, but it conveys the situation. So student name, address, here's a parent personal statement. So family history, the first paragraph is about our daughter Olivia. Again, You're not sending them a whole bunch of medical records. You're doing a quick summary on here's the issues and here's what happened. Second paragraph was basically bringing up our daughter Olivia. Third paragraph, in 2013, the company that I work for changed hands several times, and right after they sold the company and it was closed, they eliminated a bunch of upper management positions, and I was one of them that got eliminated. So again, it's all stuff that's kind of out of your control. And again, this is your opportunity to plead your case. Here's the things that happened. Yeah, you have one. Thank you. Okay, here's all of the other charts that I showed you that we were doing with the spreadsheets. This is where this stuff comes into play. So financial impact to the family. Again, a paragraph, a couple of paragraphs, and all you're trying to do is convey, here's the situation. So second one, currently we are once again considering refinancing our home to get a better interest rate as well as consolidating medical bills, Here's that summary. So I kind of go through the same thing where I explained to them that at that point I wasn't doing records, but based on this 10 years of history, here's what it would look like. Again, this is the chart we looked at earlier. So there's 2005 through 2014. There's the actuals. The one right below it is the summary between the two. And I'm being very upfront, telling them that it was based off of averages. But it gives you a big picture of the whole situation based on a duration. One of the other things, and this I know people get a little bit unsettled about talking about a lot of financial stuff. And what we've learned through the years, working with the schools and working with lending agencies, the more information you can give them to portray it, the better off you are. So in this particular one, I actually listed, here's where the medical balances lie, and here's what our monthly payments are. You look at it, on secured lines of credit, it was $207,000. In unsecured, I had an additional $64,000, totaling $271,000. Of that, the monthly payments were almost $4,000 a month. How many people can absorb that and take on more? Yes?
This is over all those years, or just?
This is a snapshot from 2012 where everything was kind of combined. So in 2012, this is where we were at. But a lot of these balances had been rolled in from over the years. And then I'm sure a lot of you have carrying bridge pages. Again, people get really reluctant to share information. This is a vehicle that you can use to your benefit. So in here, we also gave them, I edited it out for this example, but we actually gave them the carrying bridge address. Go look. They go back far enough, they can see everything that we did journal entries on. Then with that, typically, at least for the schools, they want copies of tax returns. In this particular case, Olivia also had tax returns, and we attached that information along with this letter, and this is what we supplied to the school. Again, most people are uncomfortable about providing that level of financial information. Unfortunately, what we've learned is this is the level of information is what's necessary. Anything less than that, people become skeptical. So it's difficult, and to be honest, it took me a long time to really get comfortable with it myself, because that's not something I really talk to anybody about outside of the family. Yeah, except for everybody now, yeah, and Washington, and in Washington last year. So as you can tell, I've loosened up a little. The amount of financial help that can be provided is directly based on the information that you supply. And in this particular case, more is better. So here's just a couple of slides on some things to look into. Again, we live here in Minnesota, so A lot of this is going to be Midwest-based, but there are a few of the programs that Cathy will talk about that are national. But in our... What's that? Yeah, and you may have, the reason we're bringing them up is you may have vehicles like this where you live, just under different names, so you got to do a little bit of hunting. But Spare Key was one of them that we actually used probably 10 different times, and they will pay 1 month's mortgage for a family with a child that's been hospitalized for an extended period of time. They serve, yeah, I think you had to be in the hospital 20 days, I think that's correct. And anything beyond that, they would pay I think there was a limit of $1,500 if I remember right. But they would basically pay that amount toward one mortgage, just to kind of help take the pressure off of you and allow you time to be at the hospital. Workforce. Sorry? Yeah, we're assuming that every state has a version of this. In Minnesota, it's called Workforce. It's through the Department of Employment and Economic Development, and it provides counseling and training to people with disabilities. So I'll touch on this one just a little bit. So both of my daughters went through these programs, and they all, because of the disability, they also have avenues where they can help pay for some of the college or two-year programs as well. But again, you got it. If you have the financial track record, you can do a special circumstance letter and show them where you're at. In most cases, it's similar to the government where there's, they're looking at the parent stuff. By being able to provide a letter saying, hey, as much as I'd love to, I can't do this, they'll roll forward with it. Allina Care. Allina is one of the bigger hospital or healthcare networks in our state, and they do have what they call a Partners Care Program, and it's established to assist patients who do not qualify for medical assistance or Minnesota Care, and with income levels at or below 275% of the poverty level. As an example, our middle daughter Tracy was on this for a number of years, and depending upon where she was at with income and stuff, they either gave her a significantly reduced, sometimes up to 50% off on the bill, and she had a couple of years where she wasn't able to work, and they literally wiped out the whole bill. So there are some things out there, but you really have to look. And again, with Tracy's piece of it, she was able to get on this because she was separate from us at that point. Pacer Center, yeah, they work nationally, and they provide assistance for children with disabilities, bullying prevention, and parent workshops. The Minnesota Parent and Training Informational Center, we've actually gone to a lot of classes with them over the years to do IEPs, those types of things when you run into trouble. It's a phenomenal resource. So if you don't know about it, I'd encourage you to check into that one. The other gem that we found, accidentally, actually through one of my employers, they offered you the opportunity to purchase an AFLAC policy. So in Minnesota, they offered a hospitalization policy. So being skeptical, it was like, okay, what about pre-existing conditions, all of those kind of things. So we had Olivia with hydrocephalus, and we had Tracy with RSD, and the way their policies were written, you just had to go 6 months without a claim, and then they would start paying. So I asked, okay, if she's in the hospital, does that count if I don't turn it in? And he said, no, that's only what we physically see. So I think at that point, it was about $100 a month, and you could cancel anytime. We waited 6 months, and each time they came to a hospitalization, they would pay. They've got some maximums that they'll go for, but the nice thing about it is they pay totally separate from what your health insurance does. They'll look at it and they'll say, okay, did you go through the ER? Were you admitted? Yes, okay. Here's the dollar amount for that. For the first 10 days you were in the hospital, here's the dollar amount for that. And then it was on a sliding scale. But I think this cost, if I remember right, it was just under $700 a year. And I think the first year we had it, they paid us more than $7,000 back. So again, it was just kind of a general hospital policy. And like I said, had we known or had we run across that 10 years earlier, that would have made a whole different impact on our picture. Most of the hospitals do have, again, some financial assistance. Programs are typically limited by the amount and the duration. In today's society, a lot of people are doing GoFundMe pages. Instead of trying to do the traditional fundraisers, a lot of times people will set up something like this, and through Facebook and whatnot, you can reach out to so many more people. So that's out there again as an option. America, the only first world country where people are afraid of their medical bills. You know, and that's one of those things, like I said, if you're in for 3 days or 100, you're just shocked at the bills that you get. And our situation may be extraordinary because we have 2 daughters with medical conditions. However, it is by no means extreme. We know other families within our hospital family, circle of friends that are in similar situations.
One of the best things we found for a daughter who suffers seizures or hydrocephalus or any type of medical issue is a smart monitor, and it looks like an iPhone watch. She suffered a seizure in her college, and the college would not even let her come back until we got her some type of thing, because when you're in a college and you call 911, the address is the college. It doesn't tell you you're on this floor. There's no way to find her. So this has been a dream. All she has to do is press one button, and it will automatically send out texts to whoever she puts in there. And if we don't get her text, one of us would be horrible, but then it would go 911. And it will give them close enough GPS to find her. So that's been, and it also will, if she does have a seizure, it will sense seizures and also send out an alert.
Through the motion.
Through the motion of the seizure. But for her, she just feels better having it. So she only wears it when she's alone. Other than that, she doesn't.
Yes, so that one is what Olivia has right now. And I think if I remember right, there's 2 models available. They're like $139 and $199. And then there's a monthly subscription. I think Olivia's on the gold plan, I think, which allows you, they typically are set up based on how many people you could contact with an alert. And I think that on the gold plan, I think it's like $29 a month.
No.
No, they're not. No.
And there's new ones coming out. We've been on a waiting list. Is that the next one? We've been on a waiting list for this Empatica, which is supposed to be unbelievable. Like it will also tell her when she's getting too stressed and when her heart rate, it gives her even earlier warnings. So we're on that waiting list. We've been for like a year. So when that comes out, if you ever hear Empatica, that's going to be an awesome one. Now, this next part is just fun stuff that we've run into, because obviously having a lot of medical bills, you maybe can't spend money on going to the Twins games or getting your kids things. So through the years, one of my favorites is called Acing Smiles, and this is throughout the U.S. And we just found out about this when she was 18. I wish I would have known earlier. But it's a nonprofit organization that provides custom celebration cakes and other treats to families impacted by critical illness of a child. And this is Olivia. She had her 18th birthday cake, and then they did her graduation cake. And what they do is they find bakers around the area, and then they, of course, want to do it for charity, and they love doing it. These people were just so excited to do it for Olivia. So that was awesome. And like her graduation cake probably would have been $1,000. It was the center of everything. So that's one of our favorite. And we are handing out a brochure or a thing with all these. Hope Kids. Hope Kids is probably the best thing that's ever happened to our family and anybody in Minnesota. Also, Colorado and Arizona and Texas have Hope Kids. And they're hoping to get it in other states. So when I first saw it, I saw the brochure and ignored it because I thought it was for cancer children only, which was a mistake. We project didn't get done as quick. So if you see Hope Kids is coming, and it will be because they're trying to, it's amazing. They provide ongoing events and activities and a powerful, unique support community for families who have a child with life-threatening medical condition. And hydrocephalus 100% qualifies for this. We cannot even explain the things we've been able to do. I mean, every sport, you know, hockey, football, we've gone onto the field with the Vikings. Every week they have movies you go to, so you see every movie that you want to see. Plays all the time, all the Broadway musicals Olivia's gone to in town. She's done some stuff with Adrian Peterson. She's done some, went to the Wild game and was able to go down and meet with all of them. And date nights for parents, we get to go to, thousands and thousands and thousands of dollars. And it's just, I cannot even say enough about it because it's the best organization I've ever. So what their focus was, some golfer years ago saw that how fun the MakeAWish were. So his thought was, well, these kids, they get so excited about their MakeAWish that they feel so much better looking forward. They have hope. So then his idea was, well, once you have a MakeAWish, that's kind of sad because then now that's done. So their hope was to try and they want kids to always have something to look forward to, always. And the nice thing, and I don't know how long they'll keep this up, but once a Hope Kid, always a Hope Kid. Therefore, Olivia, who's 20, is still a Hope Kid. And it's for parents and siblings. And grandparents and sometimes friends. Yeah, it's awesome. So Hope Kids is a big one. Make-A-Wish. Now I know we've had some people in other states saying that their child did not qualify for it, but one of the nurses, I think, came up and wanted Olivia to try for it, and Olivia got it, and then somebody else put in a request for our other daughter, Tracy, so we've been on 2 Make-A-Wishes. So I would try or ask or have somebody, a grandparent, a parent can do it, but it's well worth it.
Yeah, our understanding is there's general guidelines, but it varies from state to state. So just because somebody got turned down in a different state doesn't mean you shouldn't try.
Right.
The worst they can do is say no.
Right, yeah. And now this one, I heard about it and handed it off to my friend here because my daughter, of course, is too old. But it's called Peach's Neat Feet, and it's anywhere you can get this. And they, for Hannah, little Hannah here, she just tells them what she likes best, some of her fun things, and then they design and hand paint these shoes for these kids. And they're adorable, and I've seen more than a few, and I love them. So that's another fun one to keep in mind, or share with other people with little kids. So that was an awesome one. Thank you, Hannah. Oh. And this is another one. Someone came to us. It's called Love Quilt USA, and you can just Google these, and it's on our list. But it's people from around the world that love to do quilting. So Olivia loves dogs, so people from all around the world made her all these dog embroidered pieces for these quilts, and then they put them together. I can't remember what Tracy's was. But they're beautiful, and on Olivia's dog one, it'll say where the person's from, like from Germany or from Ireland, and they're washable. And we've had more people comment when she's at the hospital with that. So that's another one that who would have known? Faith's Lodge. This is in Wisconsin, and I'm sure there's things like this. I've heard from other people there's things like this, but this is a family that had lost their child. So they opened this up at first to people to come that were dealing with the death of a child, and then they decided to open it up for medically complex children. And we've been there a few times. Absolutely wonderful. You spend a weekend or 4 days with families just like you, and you can forget about all the medical stuff, and they have, you don't pay a dime, and the food is there, and you go to lakes, and it's a beautiful cabin. So that's something to look for if you ever see anything like that. And like I said, this is in Wisconsin. Head huggers. When Olivia was in one time, and I knew her hair was going to be pretty short, and I went online trying to look because I knew for cancer patients they had hats and stuff. So I got a hold of this head huggers, and they were like, "Oh my gosh, tell us what you need." And they knit her every color hat she wanted and sent it to us in a little bit. It's another thing where all these people from around the country, and they will non-smoking, they go through all that make sure they're clean. And we got them, and Olivia was thrilled. It made her day, and she still loves wearing hats since that time. This is in our house. Life isn't about waiting for the storm to pass, because it may not. It's learning to dance in the rain. And that's it. And then we do have the brochure, so if anybody has any questions, yes.
I'm not a lawyer, but I'm just asking, what are your suggestions on having a financial advisor or a lawyer through all of this? I mean, you're an outstanding couple, but the average Jane and Joe may not be able to integrate all of what you've done.
I would say have some.
Yeah, we've worked with a financial advisor as well as our CPA that does our taxes and whatnot. And every year we have at least 2 meetings with each one of them. So yeah, I definitely recommend that.
I mean, it would help.
It definitely helps. And as far as items that can go in the spreadsheet, if you can get online and just Google IRS medical deductions, you can find all kinds of lists, and it's actually amazing. There's things that you just haven't thought about. So the biggest thing with this is, like I said, if you get kids that are going off to secondary schools and whatnot, lending institutions, if you need help trying to figure out how to handle the debt, again, our best advice is try to find a small hometown type bank, that type of feel, and work with them. But yeah, financial and
I wouldn't think a lawyer. It's probably not a lawyer.
we haven't worked with a our
Our
per
daughter's
se
a
on
lawyer.
it. Our daughter is a lawyer, but we
Yeah.
haven't worked with one. It's been financial counselors and CPA.
Thank you.
You're welcome.
Any other questions? Yes.
Or any expenses with education prior to college for your daughter with hydrocephalus, like
Me-
tutoring or
No,
private
we-
school or anything like that?
We were very fortunate in Minnesota. Our daughters had unbelievable IEPs, but I would have. I went to them once and threatened that I was going to go pay for a tutor, and they're expensive, to get them into the tutoring. And then they folded and gave us what we needed. So, but yeah, you could use, right? If you had to pay.
Again, you have
For
to be,
sure.
It depends on the amount, and this is where working with a CPA is helpful, because for like the spreadsheet with the balances that would go to the college, they'll accept that. But it's not something you can probably use on your taxes. So that's where you need to be real clear on where the information is going. But for something like that, the college would consider that.
And then also, isn't this conference we use to write off?
Yep.
So everybody remember things like that, write off anything from here.
Yeah.
As far as medical.
Yep. And again, CPA.
Yes, CPA.
They will actually give you a lot of tips.
Yeah. Any other questions? We're good? What? And one last thing?
IEPs at all?
No.
Just, okay.
No, thank you so much.
Yes, thank you.
Thank you.